Hello, Wayne County Community College students. This is a urinary exam clues. So we didn't have a lot of time to go over some hints and clues for the kidney exam, but let's take care of it now. You're going to need to know the regulation of the acid-base balance in the bodily fluids. Please remember that that is controlled by hydrogen ion concentration. Anytime we're talking about acid base, we're really looking at the hydrogen ion concentration. How many hydrogens are there? The more hydrogens, the more acidic. The fewer hydrogens, like more hydroxyl groups, for example, remember that's more basic. More hydrogens, more acidic, a lower pH. More hydroxyl groups, more basic or alkaline, a higher pH. Keep that reference in mind, okay? So that goes on through about 3 of the next few questions about pH. Remember, 0 to 6 is acidic, pH 0 to 6 is acidic, 8 to 14 is basic or alkaline, and remember 7 is neutral. Why is that? Because 7 has equal amounts of hydroxyl groups and hydrogen ions. Remember, we use water as the basis for checking on acid base. If you have equal numbers of hydrogen to hydroxyl groups, that's the OH part, then you're going to have a neutral specimen. Our blood pH runs in between that, from 7.35 to 7.45, and that's what you'll need to know. Usually we just look at a blood pH of 7.4 of saying that that is the key. But if you can take it from 7.35 to 7.45, that's good enough. I think you know the most acidic substance in the body. Please know that it's in the stomach. Know what ketone metabolism is from, okay? Know what that's from. Know about glucose catabolism, know what that makes up. Know about the respiratory response. If we have this says an example of a physiological buffer system would be with a delayed response time would be, what kind of buffer would that be with the delayed response time? We usually use just the kidneys and the respiratory system to help us balance things out. So we will look at the respiratory system for that. Let's see, talked about that. What is considered a powerful physiological buffering system? That would be the kidney, okay? Kidney is a very powerful buffering system as far as making sure that we don't get too acidic or too basic. And this is why I try to impart to you that you don't need to drink alkaline water. You just need to drink water. That's it. And cut out most of the other things, okay? And that the kidneys will function properly and for a much longer time. Okay, I need you to know that the blood pH, we already talked about that, it's about 7.4, correct? It's a lot of pH stuff in here. If you have prolonged hyperventilation, in other words, you're blowing out a lot of CO2, correct? When you are getting rid of CO2, that's hyperventilation, how does it leave your pH of your blood? If I were to check your pH of your blood, after I got rid of our waste, after I got rid of a lot of CO2, the blood will be alkaline because I got rid of the acidic CO2. Do you understand that? That's a concept that you must understand. If, on the other hand, I am not able to breathe, I have hypoventilation, that's low ventilation, as compared to hyperventilation, which is a high ventilation. Now, hypoventilation, I'm not breathing as much. No breath. No breath. What is that going to do to the body? Correct. You're going to retain CO2. You're going to keep CO2 in the body. I check your blood. What is your blood pH going to be? If you're keeping CO2 in the body, the blood pH is going to be low. it's going to be acidic. This is the concept you need to know. If I get rid of CO2 by hyperventilating, I get rid of all the CO2, the blood pH is going to be high. I will be considered alkaline. If, however, I don't get rid of the CO2, I hold on to it by holding my breath, or somebody's choking me, or maybe I have a big old apple core stuck in my throat, then I'm hypoventilating. That's going to make me retain or keep CO2, and the blood pH will be lower, and that will be alkaline. I hope I said those things correctly. In acidosis, what does the renal tubule excrete? If you have acidosis, meaning your body is retaining a lot of acids, and the urinary system wants to get rid of it through hydrogen ions, so it will increase its urination of getting rid of the hydrogen ions, right? A decrease in blood pH. So now the blood pH is low. That means that the blood is acidic. It will stimulate increased respirations. Why? Because if the blood is acidic, you want to breathe out the CO2 to help get rid of some of the acid that's in the body, to get the body to go back and to be an acid-base balance. Please get the concept of acidic blood and breathing out really fast, hyperventilating, to get rid of the excess acid in the body, to get back to a normal pH. Okay, so just remember, just know about hydrogen ions. The more hydrogen ions excreted by the renal tubules, the fewer the potassium ions excreted. The more hydrogen ions that are excreted by the renal tubules, the fewer potassium ions will be excreted. So if you're getting rid of a lot of hydrogen ions, you don't need to get rid of the potassium as well. So you can hold on to the potassium. Usually those two will change. They are, if there's a lot of potassium ions getting being held onto, then the hydrogen ions will be peed out. If it's a lot of, so they usually go opposite. High potassium ions, it's going to be lower hydrogen ions. Higher hydrogen ions, it's going to be fewer potassium ions. Please know, be able to compare a pH of 6, for example, to a pH of 4. Know which one has more hydrogen ions in it. You know that the more acidic solution, the pH 4, will have the more hydrogen ions. Know what's basic, like oven cleaner, baking soda, household ammonia, and the Great Salt Lake water. Know that. Know when the respiratory center is stimulated. Please know the following. What is true is, so you will remember, if you hypoventilate, please remember that your pH is going to drop because you're now holding on, retaining the CO2. That's a concept. I have about 20 questions on that same concept, and it has to do with hyperventilation and hypoventilation. So make sure you read over that specifically in the acid-base chapter, and I'm hoping I'm giving you the information that you need now. An abnormal change in the pH in the body could disrupt, of course, the enzymes, the cell membrane receptors, the hemoglobin, everything. Change the pH in the body, that becomes a problem. Know what pH means. Know the most rapidly acting buffering system in the body is a chemical buffering system. pH is okay, know about that. Know about prolonged hypoventilation. It can decrease the pH enough to produce acidosis for sure. In the kidney tubule, you know whatever in the tubule is considered secretion. Whatever stays in that tubule will be excreted. So when we talk about the kidney tubule, please remember that if it's in the tubule, that's secretion that will be considered excretion, which is going to be, you're going to be the person will be urinating. So this one asks about the kidney tubule base bicarb reabsorption and hydrogen ion excretion. So you got the tubule bicarb reabsorption and hydrogen ion excretion. What happens to the urine when those two are in existence, right? Then we talk about what to do. Remember, when you're vomiting, you're having emesis. How does that leave the body? You're throwing up. So what's going out? Hydrochloric acid. So if I check the blood is going to be basic because you threw up all the acid. So I need to replace the basicity, the basic part of the blood. So just remember that, okay? Because I have a question about emesis. When you're throwing up, you're getting rid of acids. When you're pooping, you're getting rid of bicarb or bases. So you have to remember what you're going to replace it with. If you're throwing up, you're getting rid of acids. So you're going to be too basic, right? And that will the hydrogen ions replacement. Okay, so I need you to kind of just go over this metabolic alkalosis, which is a cause. I think I gave you the chart when the person, what are you going to do with that? Well, the chloride ions of the solution in a normal saline will replace the bicarb ions and relieve the bicarb excess that's responsible for the person's condition. Sometimes women are pregnant and they'll have what we call hyperemesis. And people keep trying to give them something to drink or something. No, when you have hyperemesis, don't drink or eat anything. The main thing for that is to probably try to get to the doctor if you can, but sometimes that's not necessary. Sometimes you just need to eat like a soda cracker or something to get some saline and some base back into your system that will kind of, not really base because you got rid of all the acid, so you are basic. So I meant to say you just need to get some some chloride ions back into the body. That's what I meant to say, because you're already basic because you threw up all the acid, so that leaves your body basic. But you need to relieve that basicity, all that bicarb, and the sodium ions will do that. That's why oftentimes they'll say, here, eat some saltine crackers or something like that. But the main thing is stop giving the person something to drink because they're going to really keep throwing it up. And you don't want to get dehydrated, so you'll probably want to go get an IV at the doctor. Let's see, what else? Know that what lies in the medulla and what is in the cortex of the nephron. Know what's in the medulla and what's in the cortex. That division is going to be very demarcated, and you need to know what that is. Please know what the urinary system is for and what it's about. It seems like I had this other question on here twice. It's about pH. Know about ADH, antidiuretic hormone. Where does it have the greatest effect of reabsorption of water? Please know where that is. And that's actually going to be in the distal tubule. That distal tubule is very important for reabsorption of water and for aldosterone as well. And so those things, and if you remember in the renin, angiotensin, aldosterone kind of scheme of things, that will be an important place. The distal, or we call it the collecting duct, right? Distal tubule. Oh no, the distal tubule. The distal tubule is connected to the collecting duct. So the distal tubule is the greatest effect of where ADH is. And the aldosterone has the greatest effect in the collecting duct. So let me clarify that. Increase respiratory rate. Remember where the beginning of the plumbing system is, right? We talked about renal columns, we talked about renal pyramids, we talked about the ureters, but remember the calyces, the calyx, okay? Know what podocytes are. Please know what that is. I think I mentioned that before. We know what everything is involved with having an acid-base balance. You need buffering, you need the acids, and you need the base. Well, this one asks, how does the body respond if respiratory mechanisms are unable to stop a pH shift? You're going to look at a renal physiological buffer system that involves the excretion of either an acid or a base in the urine, and usually it will take about 24 hours to get that started. When you want to look at the body's response if the respiratory mechanism is unable to stop a pH shift. Now remember, if the respiratory system is affected, then you're going to use the kidneys to compensate. So, and if the kidneys are involved in a pH problem, then the respiratory system will compensate. Remember those opposite. Know what hyperkalemia is and the effect that it has on certain organs. Most people that work in the industry already knows that that has a big effect on the heart. Hyperkalemia is an increase in potassium, okay? Please know what that is. We talk about hyperventilation a lot. Please know what it causes and the ramifications of that. Know the same for hypoventilation as well. Know about ADH and how it reacts to or comes into play with dehydration, because remember, ADH kicks in when the blood pressure is perceived as low, and we talked about that as far as having severe diarrhea, like in cholera, or hyperemesis, like when women are pregnant, or dehydration, like say you're in the Mojave Desert and you didn't bring your water and the sun is just beaming down on you, or like I mentioned too with Michael Jordan and Mike Tyson doing their sports things, they could really sweat out an immense amount of fluids. So please know what happens when you're dehydrated to that point, or when you have lost that much body volume, and what happens with the whole renin-angiotensin system and ADH specifically. Please know about the Tmax for glucose. We talked about that a little bit, that every receptor and everything has a maximum, and if you cross over that, then for glucose then the rest of the glucose is going to be urinated. You're going to pee it out. That doesn't necessarily mean that you have diabetes. That means that you just have consumed so much sugar that you maximize the amount of receptors that are available, and that the rest of it, say we have like a 300 milligrams per 100 milliliters of capacity for glucose in the nephron. If you go over that, then you're going to pee out the rest. Or if you go over to 300, then you're going to urinate out whatever. Maybe it's 25 more, you'll pee out the rest. So it's important. And if you keep doing that, eating a lot of sugar, then you can definitely make yourself go into getting diabetes. But just 1 or 2 times with this glucose in the urine, no, that does not indicate diabetes specifically. No, the blood pH 7.35 to 7.45, because I have a few questions on the blood pH of humans. Hydrogen ions, I got a lot of questions on that. Please remember that the bladder can start to feel distended at about 250 milliliters, right? Know the difference between the afferent and efferent arterioles. Remember, interlobular artery feeds into the afferent arteriole. The efferent arteriole feeds into the peritubular capillary. Let's see. Know about the collecting duct and the distal tubule. Please remember how they passively, just when you look in the text, look at the entire nephron, and you'll see the different things that are going on with it. I didn't talk about the counter transport and all that. I didn't get into that. I really just kept it very broad. but I'm relying on you to go back and fill in some details. That's why I'm going over this, so that you can really get into your study. Look at the active reabsorption, the passive reabsorption, where things are actively secreted or passively secreted. Check out that nephron so you can see what's going on around it. Make sure you know the cellular metabolism of ketones. Really, you don't want your body to get into a ketotonic state. You'll see that with diabetics. They'll have ketone acidosis, and that's really because their insulin is not being regulated, and the body has started to consume itself, so to speak. And I know a lot of people go on ketone diets, but that is really not a healthy way to reduce your weight. Let's see, alkaline. Remember how much blood is pumped by the heart each minute that goes through the kidneys. I think we said it was about 20%. 20% comes out to be about 1/5, right? Know about the male and female urethra, how it's different. It seems like I had this question twice too. I don't know, some of these questions I feel like I have asked a couple of times, but maybe that's an advantage for you. I think it's like 97 questions, and you'll be given plenty of time. I think you're going to be given probably 2 hours and 20 minutes or so. So you'll have plenty of time to do the test. It's just that I don't know, I have a lot of repeats, I think. Or maybe I think I'm asking questions in a different way. The answers are different, that's for sure. Know about reabsorption and where that's performed in the kidney. Know about the substances that travel from the glomerulus. Okay, if I say glomerulus, what's the first thing you should think of if I say glomerulus? Well, you might say it's a tuft of capillaries. That is true. But think of the glomerulus as why? Why is it a tuft of capillaries? Yes, because it's there for filtration. Filtration. Remember the 3 things that go on in the kidney. It's a lot of things that go on in the kidney, but the 3 things that I'm interested in you remembering at just this point will be reabsorption, secretion, and filtration. And there's a lot of things that go on in the kidney, and so you could go over those things as well. So go over the prolonged hypoventilation. Go over the prolonged hyperventilation. Make sure you get those concepts down. Know about what mechanism is used for voiding. In other words, you need to relax the internal sphincter in order to urinate or have micturition, right? Know which way secretion is going. Secretion is going which way? Into the tubules, because whatever in the tubules will be is being secreted going into the tubules, and then it's going to be excreted. Anything coming out of the tubules is called reabsorption. In other words, it's coming out of the tubules and going back into the body. I asked that question to make sure that you understand which way things are going. Peritubular capillaries, make sure you look around those peritubular capillaries that are going around the loop of Henle, especially, and know what that's for. The movement of molecules out of the tubules and into the peritubular blood, that's reabsorption. That's how it gets back into our vascular system, going back and now into the inferior vena cava, right? Most rapidly acting buffer is chemical. I don't know what. Most acidic substances. I have some of these questions are being asked twice, I think because when I had 2 chapters mixed together, some of them didn't, I guess I didn't erase some of them. So that's going to be good for you. Just take them as a bonus, okay? So the more okay, I talked about that one, nitrogenous waste. Please remember, know about nitrogenous waste. It's a result of protein catabolism, right? And that has to do with urea, ammonia, and creatinine, correct? Remember, we check a BUN, which is the urea, and the creatinine to always check the function of the kidney. Please know that the percentage of water in urine is about 95%. Portion of nephron that empties it to the calyx. What empties it to the calyx? The collecting tubule. know the shape of the kidney. I think we talked about that. And I said we check creatinine and BUN to check the function of the kidney. Know how many openings there are and what a trigone is, if you recall that. You can see that diabetes is also called diabetes mellitus. So if you see that, just please know that if you have a buildup of ketones, we call that diabetic ketone acidosis, that it is the same thing as diabetes mellitus. Where is the workhorse of the nephron? Please remember, a lot of reabsorption occurs in the proximal tubule. A lot of reabsorption, a lot of nutrients, especially glucose, comes out from the proximal tubule. Know how the structure of the kidneys to the ureter, to the bladder, to the urethra. At least have that in mind. So we'll be talking about that. Please know what ADH is for and what it's doing. We talked about if you don't control your diabetes and some spill into the urine, what that's about. The kidney secretes. When the kidney secretes hydrogen ions, it primarily reabsorbs what ions? That would be sodium. It primarily reabsorbs sodium. Whenever you think about aldosterone, I want you to think about potassium, right? Think about potassium. Potassium is there because you're really gonna just think about potassium. We'll leave it at that. Know what the ACE inhibitor drug, what an ACE inhibitor drug will do. Please understand it in the context of the renin-angiotensin-aldosterone system and where the ACE is coming out from the lungs, the angiotensin converting enzyme. Please know what it does, and that's why and the reason that we give ACE inhibitors to people that have high blood pressure. Make sure, because you're going to have to switch your thinking on that, so make sure you know. Know about the afferent arterioles. I'm asking that again. Know about ANH, atrial natriuretic hormone. Quite the opposite of ADH. Please remember that. That is for people that it's going to make you urinate more, diurese more, to get rid of volume. Your blood pressure is too high in this case, so you're going to get rid of volume. That's different than ADH, where your blood pressure is low and you're trying to hold on to volume, okay? Know the nitrogenous waste, most abundant, that's found in the urine. Powerful physiological buffering system. Let's see. I asked a couple of these questions a couple of times. That's okay though. Know what is not a normal constituent of urine. So please know what urine should be made up of and what it should not be made up of. Which I find is not a normal function of the kidney. Know what is not a normal function of the kidney. So please know what the kidney is for. Know about the parietal layer of the glomerular capsule. Let's see. Know what goes in and out of the hilum. Remember the hilum? Yep, I see a few questions that are asked again, but that's okay. I'm not going to change them. That'll just be point you get. Which one is not true? Oh, know which kidney is larger, which one is a little smaller. Know where the kidneys are in the body. Retroperitoneal, right? Know there's limits from the thoracic vertebrae to the lumbar vertebrae. Know what those are. Know what the ureter's tissue layers of, what is that? Tissue layers are made of. Know what the tissue layers are made up of, right? So that you can get that one correct. Know what's classified as an accessory organ of the urinary system. An accessory organ. The threshold for absorption of glucose, please know that. what types of acids will be produced when you have glucose catabolism. Please know that. I asked that question twice, but it's twisted in a way. Greatest amount of hydrogen ions. You'll know that that is a low pH. If you have a lot of hydrogen ions, a low pH. Know where the kidneys are. Know about the male urethra and how it doesn't allow a mix of urine and semen. Know where the renal pelvis is and the renal pyramids. And the last one has to do with indicators of kidney dysfunction. Please know that you will look at increased urea and creatinine levels in the blood, and that will be an indicator that the kidneys have an inability or aren't filtering creatinine and urea very well. So that really is the summary of the test. And we've gone over everything that's on the test. This is the test, so I went page by page. You just have to go over the videos. I gave you a big picture on the 2 videos, the anatomy and physiology of the urinary system. Fill it in by going through your text and then listen to this urinary exam clues, and that should do it. I'll have the other videos up for reproduction and endocrine. I'll have those up soon, but in the meantime, the test will be on Thursday, I think that's June 4th, through the end of Friday, June 5th in the evening. So you have that time frame, but it is only scheduled for, I think, about 2 hours and 20 minutes. I can't remember right now, but it is scheduled for only about a couple hours. So that'll be it, and I'll talk to you later.